Stand by. This is a 1-minute cue. Stand by.
How are you? Good afternoon, ladies and gentlemen. My name is Nirav Shah, and I'm the director of the Maine Center for Disease Control and Prevention. I'm joined today by Commissioner Jean Lambrou, the Commissioner of the Department of Health and Human Services. We're here today to provide an update on the COVID-19 situation across the state of Maine. As of this morning, Maine CDC is now reporting 698 total cases of COVID-19 across the state. This is an increase of 65 cases since yesterday. And as we'll discuss, a large part of this increase is related to a number of outbreaks that Maine CDC is working on in long-term care facilities across the state. Of the 65 new cases, 48 are related to long-term care facilities. And of those 48 cases, 13 are among healthcare workers and 35 are among residents of these facilities. I'll get back to the facilities in a moment, but I'd like to provide some additional numbers with respect to where we are as a state. There have been a total of 124 hospitalizations since we began our activation. And at present, there are 61 individuals in the state who are currently hospitalized with COVID-19. 39 of them in regular patient beds, and sadly 22 in intensive care unit. Hospitals across Maine also report that as of this morning, 9 individuals in Maine are on ventilators related to COVID-19. Sadly as well, there have been a total of 19 individuals who have passed away with COVID-19 since we began our activation, and 273 have recovered. All told, Maine CDC epidemiologists and clinical staff have now fielded 4,665 consultations from healthcare providers across the state. I'd like to provide a brief update on 3 of the outbreaks that we are working very intensely on that are centered in long-term care facilities across the state. The first is an outbreak at the Tall Pines facility in Waldo County. There are a total of 23 individuals affiliated with that facility who have tested positive for COVID-19, 19 residents and 4 staff members. And sadly, there have been 2 deaths in individuals affiliated with that organization. I'd like to turn next to the Maine Veterans Home in Scarborough. As of this morning, there are a total of 32 cases of COVID-19 associated with the Maine's Veterans Home in Scarborough. 26 residents and 6 staff members. The bulk of those individuals who have been tested there are asymptomatic. I'd just like to pause for a moment and note that the residents of this veterans home are individuals who provided selfless service to this country during a time of need. And it is our intention to do the same for them now. Finally, I'd like to provide a brief update on the outbreak that we've been working on here in Augusta with the Augusta Center for Health and Rehabilitation. We learned yesterday of an increase in cases at that facility. There are now a total of 55 cases affiliated with the Augusta Rehab Facility, 41 positive residents, and 14 positive staff. I'd like to put some of these numbers and some of the work around outbreaks in long-term care facilities into context. Certainly these numbers, both in terms of the number of cases as well as the number of facilities, seem concerning. But what I think is important to note is that our policy at Maine CDC with respect to testing individuals in long-term care facilities for COVID-19 is very aggressive. As soon as we detect even the faintest light of an outbreak at a long-term care facility, we recommend universal testing across the facility for all staff and all residents the second we detect an outbreak. One of the things that we know in public health is that when you look for things, you find them. And indeed, much of what we're seeing here is just that. The fact that there are high numbers of individuals in these facilities does not mean that there are high numbers of critically ill individuals in these facilities. In fact, many, if not most, of the positive results that we have seen in these facilities have been in individual residents who do not have symptoms. I'd also just like to take a moment to note that we have been working very, very closely with these facilities. For weeks now, we've talked about how long-term care facilities are a top priority, a top concern of Maine CDC. There are many reasons for that. They have medically vulnerable residents, often in close quarters, often who interact very closely with one another during meal times, for example. And based on the experience in other states, we know that coronavirus can spread rapidly within these facilities. But I'd like to pause for a moment and also remember that each of these facilities is populated by our friends, our parents, our siblings, and our spouses. And I ask us all to keep them in mind. Just in the past 72 hours, many of these residents were perhaps expecting a Passover dinner with their family or a visit from their grandkids from Easter. But that didn't happen because of coronavirus. And so while we talk about numbers and cases and facilities, I'd like us all just to remember that what we're really talking about are men and women, many of whom serve their country and are veterans, who are living in communities that are now being affected. We remain committed to each and every one of them and committed to their health. And so I'd like to turn things over to Commissioner Lambrou to talk more about what the Department of Health and Human Services is doing.
Thank you, Dr. Shaw. I will begin by repeating that our older residents, our people with disabilities who live in long-term care settings, are among the most vulnerable, but also among the most important as we begin to tackle this epidemic. We began our focus on these people long before the first case was confirmed in the state of Maine. Since March 4th, the Maine CDC has held weekly webinars with all long-term care facility staff to ensure they understand and know about recent guidance, as well as to answer their questions. On March 9th and March 15th, the Maine CDC issued health alert networks that include clinical and specific information on how to respond to COVID-19. On March 15th, the day that Governor Mills declared a state of civil emergency, she too said that people should be limited in their visiting to nursing homes, restricting visitation and non-essential healthcare personnel except for certain cases of compassionate care at the end of life. And on March 26, the Maine Department of Health and Human Services announced that it will pay nursing facilities for those extra costs associated with COVID-19. This includes staffing above the customary levels needed in this outbreak. This includes the cost of screening and supplies and personal protective equipment beyond what is ordinarily needed. Those rate letters will be sent this week and will send about $8.8 million or 10% increase to our nursing facilities retrospective to March 1st for the next several months. We also, as Dr. Shaw has previously said, have prioritized personal protective equipment for our congregate living facilities, including nursing facilities and long-term care facilities generally. But at Governor Mills' direction, we are intensifying our effort this week. Today, Maine CDC will be sending to all physicians and nurses in the state of Maine, through our licensing boards, emails reminding them of the importance of these actions. This includes a long-term care facility toolkit that has a preparedness checklist, includes a long-term care facility respiratory illness tracking chart, reminds people of the guidance that has been issued by the U.S. CDC as well as the United States Center for Medicare and Medicaid Services, and a model letter that nursing facilities can use to inform families regarding actions being taken to preserve the health of facility residents and staff. Additionally, tomorrow we will host a webinar for all the medical directors of these skilled nursing facilities with experts. This is a sort of information that will give people who are steeped in best practices a chance to teach others in the state to make sure they know what they can be doing to both prepare for and prevent the spread of COVID-19 within those facilities. We will continue doing that as long as is necessary to make sure every single facility has the information they need. And third, the department's Office of Aging and Disability Services, Division of Licensing and Certification, will work with the Long-Term Care Ombudsman to reach out to every single nursing facility in the state, all 93 of them, this week, to ascertain their level of preparedness, their gaps, and what more we could be doing together to prevent additional nursing facility outbreaks like the one that Dr. Shaw just described. So we are all in. We will continue to take the steps necessary to protect our older residents and people in our long-term care facilities. Ideas are welcome, but we will not stop until we protected everyone we can in this pandemic. I'll turn it back over to Dr. Shaw.
Great. Thank you, Commissioner. I also want to take a moment to talk about the folks who are often working here. Now, we talk a lot about facilities and institutions, but really what we're talking about are communities, neighborhoods, and homes. And these are homes that are staffed by individual healthcare workers who provide for, care for, and tend to our loved ones. These staff working in homes across the state keep our extended families healthy. And they do so every single day while putting themselves into the coronavirus's path each time they go to work. Now, we've talked a lot about people on the front lines. And in this case, with these types of homes, the front line is the bedside of our parents, our veterans, and our families. Imagine if your sibling, spouse, or mother's caretaker decided not to show up for work. It would be devastating. But each and every one of these men and women decide every single day, despite snowstorms, windstorms, power outages, and viruses, to show up for work. And we thank them for that. I'd like to turn next to a bit of an update with respect to our public health emergency preparedness. Just in the past 48 hours, Maine CDC has received and processed approximately 116 orders for personal protective equipment. Those orders are being picked and packed today and will be shipped out first thing tomorrow morning in combination with our colleagues at the Department of Transportation. Of those 116, 77 will be filled from congregate care settings, such as the long-term care homes that we're talking about today. In addition, for the 3 homes that we've discussed, I would just like to provide a recap of the dates on which they too have recently received personal protective equipment. The Augusta Center for Health and Rehabilitation recently received an order on April 10th. The Maine Veterans Home in Scarborough recently received 2 deliveries, one on April 6th and one on April 9th. Similarly, for the Tall Pines facility in Waldo County, which also received deliveries on April 6th and April 9th. We at Maine CDC and the entire Department of Health and Human Services are standing by to assist these facilities in every way possible, be that from an infection control perspective, an epidemiology perspective, and a personal protective equipment perspective. Next, I'd like to just provide a quick update on our vital assets, our medical supply lines. With respect to the total number of ICUs and ICU beds, right now, Maine CDC has recorded 314 total ICU beds, of which 158 are available. With respect to ventilators, there are 328 total ventilators in the state. In addition, there are 234 alternative ventilators available. Of the traditional ventilators, 283 remain available of the 328. One final note, we've been asked to provide one public service announcement today. And that is that we recognize that these are tough times. One storm is behind us, another is upon us. Power outages during pandemics come with additional challenges. Full refrigerators with food that could spoil. People who are working from home. Kids who may be studying remotely. In light of expected power outages that have already occurred and others that are expected to occur because of the pending storm, there may be longer restoration times because of crews who themselves are following physical distancing guidelines. Indeed, we've been told that line crews who are working to restore power have encountered a surprising and heartwarming increase in the number of folks across Maine who'd like to chat with them. But in doing so, sometimes come a bit too close from a physical distancing perspective. So we've been asked to mention and remind folks to give utility workers the space that they need to do their jobs, to maintain that physical distance, and get back everyone's electricity as quickly as possible. So with that, we will turn now to our colleagues from the media and begin questions. And the first question today is from Kate Koff from the Ellsworth American. Go ahead, Kate.
Thank you, Dr. Shaw and Commissioner Lambrou. 2 separate questions, both directed at Dr. Shaw. The first is, can you give us an update on how many healthcare workers overall have contracted the virus, and an idea of whether you think they're becoming infected while at work or via community transmission? And then a second question, can you give us an idea of how many weeks or months of protective gear the state has left, and whether you expect more anytime soon?
Great. Thanks for your questions, Kate. Kate's first question is the number of healthcare workers who have been infected across the state. And as of this morning, that number stands at 110 healthcare workers statewide. Now, Kate, you ask about whether they have been infected at work or in the community. As you are aware, there are now 3 counties across Maine, Cumberland, York, and Penobscot, where community transmission is occurring. It is difficult to know whether any one healthcare worker could have acquired coronavirus in the community and brought it into the facility, or vice versa. That is what our disease detectives work to try to ascertain. At this point, we don't have good insight into that, but again, that investigation is underway. Kate, you also asked about the available stocks of PPE. And you asked about it in terms of longevity. That's a difficult number to calculate because there are so many different types of facilities. But Kate, what I'm going to do really quickly is run through what we have on hand at this very moment. And then we can try to get a better sense of what the burn rate, as you say, might be on that. As of this morning, Maine CDC in our warehouse has approximately 48,000 N95 masks, approximately 45,000 surgical masks, 13,000 face shields, 92,000 gloves, not pairs, but gloves, about 1,000 disposable protective suits, about 19,000 surgical gowns, and 186 coveralls. We continue to seek additional sources of PPE, some from the private market, some from the domestically manufactured market here in Maine. Sadly, we've also been informed by the federal government that the strategic national stockpile is tapped out. But we ourselves in Maine are taking matters into our own hands and seeking additional PPE. So long as we can verify the integrity of the supplier, we are very interested in acquiring more. And we actually have an entire team in place right now that is vetting those potential suppliers to make sure our stocks remain healthy. Thanks for that question, Kate. I'd like to turn to Lee Nelson from News Center.
Yes, hi there. Just first, making sure you can hear me.
Not so well, Lee.
All right.
Much better now.
Okay, I'm leaning into the computer.
Lean in.
Thank you very much.
Lean in.
I have a two-part question, and I'm be happy to hear from Commissioner Lambrou or you, Dr. Shaw, either one who feels appropriate to answer. We've heard from several people who have loved ones in some of these long-term care facilities who have told us that they're not so sure that the guidelines have been followed there. So my two-part question is, how do you make sure these facilities are following all the guidelines they should be following? And also, how do you protect the residents in these facilities that are not COVID positive yet? There's not a lot of space in these places. Are you moving them to different rooms? What are you doing to protect folks who still don't have it yet in these places?
So thank you, Lee, for that question. The first part I will take, which is how are we ensuring that our nursing facilities are following the guidance that we've been giving? First of all, it is a federal requirement that every skilled nursing facility has a public health emergency plan, and that is dates back to 2016. It was updated in terms of rules in 2019, and we are, as I mentioned earlier, going to be talking to each and every one of the 93 facilities this week to, number one, see what their plan is. Do they need help with it? Do they need other support? And number two, if they are not in compliance, figure out how we can get them to comply, because as a reminder, it is the federal law. I will turn it over to Dr. Shaw for the second part of that question.
Great. So Lee, your second part of the question is how are we working with facilities to keep patients who are residents who are negative, how do we keep them negative? And one of the immediate pieces of guidance that Maine CDC gives when a facility reaches out or when we detect an uptick in cases is to engage in what is called cohorting. That is to say, moving patients such that positive patients are in one wing and negative patients are in a separate wing. A key piece of that is ensuring that staff don't shuttle between those different wings and potentially bring the virus from one wing to the other. So by enforcing and working with facilities to introduce that physical separation even within a facility, we can reduce the likelihood of spread of the virus within any particular facility. And based on what we've seen in other states, that is one of the better strategies, but it's important to note that even when that strategy is adhered to faithfully, transmission unfortunately can still occur. Thanks for that question, Lee. I'd like to turn next to Steve Betts from the Courier-Gazette.
Yes, thank you, Dr. Shaw. From what the CDC has learned of the outbreaks at the long-term care facilities in Maine, is there something that these facilities are doing that they shouldn't be doing, or something they haven't done that they should be doing?
So, Steve, Steve's question is about, at its core, what can we say about the facilities that have experienced outbreaks? And have they been doing something that they should have not been doing, or vice versa? And Steve, what I would respectfully suggest in response is that there's an assumption that's in your question that suggests that outbreaks, especially of COVID-19, which can be transmitted extremely quickly, can be traced to any one particular action that was or was not taken. And the notion that any of those actions was proper or improper. And in fact, what we've seen across the country is that facilities of all different types can and have experienced COVID-19 outbreaks. We haven't learned anything in particular about any of these facilities that has suggested to us, based on the COVID-19 outbreak only, that a different course of action should have been pursued. But as Commissioner Lambrou noted, each facility has an independent obligation to ensure that they have an emergency plan in place, as well as a plan for adequate supplies of PPE. That is to say, facilities themselves have an obligation to make sure they're planning for these events. Once these events happen, Maine CDC remains poised to spring into action and provide really specific guidance. And based on what we've seen so far, facilities are extremely happy to work with us when we see these outbreaks occurring.
And I will just add, in providing information from a clinical perspective as well as support. I'll repeat, we're willing to help support these facilities find the PPE as needed through our stockpile, to pay for the extra costs that they may be incurring to have that extra nurse or extra CNA on their floors to care for people, to help bring in staff where there's gaps. We know that that's been an increasing problem when there is a COVID-19 confirmed positive in places. We're willing to help. And again, resources, we are there to help. So we want to get there in the voluntary way
100%.
To make sure that they meet their federal requirements.
Yep, and Steve, I'll just add on top of that, I've personally had conversations with my team, with the leadership of both the Maine Veterans Home as well as the Augusta Center for Health and Rehab in the past 36 hours to go over all of the scientific, technical, and staffing questions and resource requests that they might have, and underscore that we stand ready to assist in every way. And again, the facilities have been thankful for our partnership. We're certainly thankful for theirs. I'd like to turn next to Caitlin Andrews at the BDN.
Hi, Dr. Shaw, Commissioner Lambrou. Also following up on the long-term care facility outbreaks, with so many nursing home employees infected, at what point do you think that these facilities will be able to still safely care for their residents? And if not, what's the contingency plan there? I know that it's difficult to say where the virus is coming from. And I additionally am curious to know if the CDC has found that any workers in any of these facilities where there's been an outbreak have worked at other facilities in the last couple weeks.
Do we do the first part? The last question.
Yep, so Caitlin, we're going to do these in reverse order. As to the latter, we are aware of at least in one instance, and there may be more. Our investigation is only just now getting underway in the past 24 hours, but we are aware of at least one instance where an individual employee had worked at a number of different facilities. We don't know whether that employee yet worked at each of these 3 facilities, but as you may be aware, it is not uncommon for facilities to share staff. For example, therapists or technicians who may have appointments at different facilities and rotate across the state. That is a common practice, not just with long-term care facilities, but in the healthcare world overall. But we haven't identified a single person that unifies all 3 of these facilities yet, but that is part of our investigatory process.
Great.
Commissioner?
And the first part of the question was, with the number of healthcare workers infected with COVID-19, is there a point at which these facilities may need to close down? So to clarify, the number of healthcare workers in the state of Maine that Dr. Shaw mentioned earlier is not just in nursing facilities.
Correct.
That includes hospitals, physicians, all settings. So just to be clear, that is a broader number. It also includes licensed and non-licensed people, That includes the people who are the environmental specialists who clean our nursing homes, as well as the admission staffs and some of the other non-clinical staff. So just to put those numbers in context is not all healthcare workers in nursing facilities. But we do take these situations on a one-by-one basis. There's no hard and fast rule. We have worked to provide flexibility in our regulations for example, nursing ratios, to make sure that we are being flexible, to make sure we can move staff and quickly make sure that residents are safe when we do have workers who may be going out because of this illness. We also continue to work with the administrators to find out, what do you need, how can we help? Again, there's no one rule, one cookie cutter, if this happens, then you close. Our goal is to work in partnership with our long-term care facilities to make sure that they provide quality care, they prevent infection, and we fill in their gaps as needed. We, thank goodness, have not been to a point yet where we've had to do anything else, but we will continue our effort to support our nursing facilities and assisted living facilities, group homes, and other type of congregate living settings throughout the Maine that are dealing with similar challenges.
We'll turn next to Amy Brown at WERU.
Thank you, Dr. Shaw and Commissioner Lambrou. You've explained in the past, Dr. Shaw, can you hear me?
Yes, I can.
Okay. You've explained in the past that community transmission means that 25% of the people testing positive have had no known contact with someone else who tested positive, and they have not also traveled to a hot spot. So is it known at all how they may have acquired the virus? Is it by touching items or possible exposure to asymptomatic people? Is there any way of tracking that? And the second part to that is, many of the grocery stores that are trying to do curbside delivery are completely booked up for days in advance. And people are also reporting that the early morning hours that are supposed to be for elders and people with compromised immune systems are becoming quite crowded. Is anything being done, especially in counties that do have community transmission, to help the stores or provide some guidance on increasing the access to curbside delivery and other alternative ways for people to shop?
Great. So, Amy, your first question is around community transmission. And in a world or in a county where community transmission is occurring, what can we say about how someone might have acquired it? And almost by definition, in community transmission, the precise time and location of when a person was exposed is difficult to track down. I think about it in the same way that we think about the flu every year, where almost every year at a certain point, we achieve community transmission in Maine and across the country with the flu. What that means is that you might have a sense of where you picked it up, but most likely you picked it up in a setting where the exact mode and time of transmission is not known. And that is, again, almost built into the definition of community transmission. As you note, it means that in a quarter of instances, we can't trace exactly where it came from. Now, I want to be really clear about something, Amy. That doesn't mean we don't try to trace it. That doesn't mean that in counties where community transmission is occurring, we don't do any investigation. In fact, it's just the opposite. We're still trying to get to the bottom of where each and every individual may have acquired it, specifically trying to protect other people in households, healthcare settings, etc. But it does imply that our disease detectives may, when they're going into the investigation, they may keep in mind the fact that this is a situation where someone could have picked up coronavirus from a casual interaction that they may not have even known where the other person had it. It may have been asymptomatic. It's difficult to pin down. Now, the other question you raise is about grocery stores.
Sure, and the question was, what are we doing about the fact that there is insufficient curbside pickup at some of our grocery stores, as well as observed phenomenon that people are going to, for example, the early hours for elderly people and vulnerable populations when they do not appear to be in those groups. So the Department of Health and Human Services is not in charge of enforcing either of those policies, but I think I can speak for Governor Mills when she, first of all, has gone out of her way through our Department of Economic and Community Development as well as our Department of Labor, to see how do we support our grocery stores as they're trying to continue to provide access to affordable food for our residents. We continue to see what we can be doing to support them in that good work that they're doing. And we thank them all for those extra hours, those extra workers that it takes to be operating in these challenging times. But as Governor Mills will also repeatedly say, it is on each person in the state to try to help ourselves and help our neighbors, to help our friends. Please stay at home if you can. Please respect the physical distancing guidance that she put into place. And please try to remember that we are doing our best to make sure you have access to the essential services that you need, but we also need you to help us keep the state safe.
We'll turn next to Sarah from the Machias Valley News Observer. Go ahead, Sarah.
Thank you, Dr. Shaw. I have two questions, one for you and one for either you or Commissioner Lambrou. First, in recent weeks, we heard about constrained testing supplies, testing backlogs, and the criteria doctors should use to determine who should be tested. As the states worked through that testing backlog and reagents have become more available, have those criteria for testing changed, and what are they today? And second, have you seen an increase in the number of calls to the state crisis hotline? And if so, what resources are deployed there to ensure that people get the help they need?
Great. So I'll start with the testing piece. With respect to testing, Sarah, just to reiterate, there is no backlog right now at the state laboratory. Samples come in and they are returned, and results are returned usually within 24 hours back to the submitting physician. You also have noted that although we have had something of an uptick in the availability of testing supplies and chemicals, there still remains a shortage. Nationwide, there remains a shortage of these vital chemicals. And so for that reason, Maine CDC has not changed its guidelines or areas of focus on testing. Let me expand on that for just a bit more. Maine CDC does not stand between any physician and their desire to test any patient. If a physician desires to test a patient and use a commercial lab, they are free to do so irrespective of Maine CDC's areas of focus. But for tests that are sent to our public health lab here in Augusta, we do have a focus on a couple of categories. Folks who are in the hospital, folks who are healthcare providers, EMS providers, and those who live in congregate settings, such as the homes we've been talking about today. We do that because we know that there is an increase of testing demand that is likely to happen. And so we want to preserve our supplies and make sure we can focus on the people who are the most vulnerable and get their doctors' answers as quickly as possible. But Maine CDC's focus areas within our own testing are not to be taken as guidelines or requirements for who any physician can and cannot test. If a physician wishes to test a patient, they are free to do so using any of the commercial laboratories or hospital-affiliated laboratories. They can even do so at our laboratory. But we do have focus areas to make sure we are getting results back to clinicians who can make clinical judgments as well as public health determinations. I'll turn it over to the Commissioner for the other question.
So the second part of the question was, have we experienced an increase in the number of calls to our crisis hotline? Anticipating that we would see more people using 211, we did augment that staff to increase the number of people on that line to make sure we can keep it open 7 days a week. And as a reminder, we have 211 for general information, and if you are in crisis, the state crisis line is 1-888-568-1112. That's 888-568-1112. So we are tracking an increase in calls to both lines, but we also, gratifyingly, are beginning to see the effects of our early actions to make telehealth more available. For example, we are quite concerned that people with substance use disorders may be struggling without being able to see their provider on a periodic basis. So through the governor's executive orders and other actions, we've been promoting this telehealth. And what we saw was in the past 6 months before COVID-19, the average number of claims submitted through Maine Care for telehealth was about 100 per week. In the last week of March, the number of claims submitted for telehealth for substance use disorders in the state of Maine was 3,600, more than a 30-fold increase. So we are striving to provide needed services, critical services in different ways, and we do urge anybody who is at home who needs health care or mental health care or behavioral health care to reach out. You are not alone.
Thanks, Commissioner. Steve Missler from Maine Public, you're up next.
Thank you, Dr. Shaw and Commissioner Lambrou. I just wanted to follow up on the testing at these long-term care facilities. A couple of weeks ago, and forgive me for not being able to pinpoint the date, Maine CDC broke from the federal guidelines and elevated patients in these facilities to the top tier, which would get them tests. My question is whether or not that affected people who were asymptomatic, whether it be residents at the facilities or staffers. Were they included in that tier 1 elevation and guidelines, and if not, was there anything to prevent people from getting tested at those facilities if they were asymptomatic, just as a precautionary measure?
Great. So Steve's question is about testing guidelines as it relates to long-term care facilities. And Steve, as you correctly note, I'm trying to remember the date as well, but I think it was about a month ago, but we can all check and confirm. Maine CDC decided to go a big step beyond the federal testing guidelines and include in our top area of focus individuals who live in all types of congregate living settings, not just long-term care facilities, but shelters for people experiencing homelessness, etc. And we did that because of a few reasons. The first is that those individuals are often medically vulnerable. They're often in close contact with each other, and there's often a high rotation of different caretakers and workers who come in and out of those facilities. And so we made that change some weeks ago to go above and beyond the federal guidelines. We've learned a lot about coronavirus since then. At the time we made that change, it did not explicitly include asymptomatic patients. But asymptomatic patients, if providers called us, could be tested at that time. But it didn't explicitly contemplate it. But Steve, what I want to be clear about today is that our position is that for any long-term care facility where an outbreak is occurring, everyone is offered testing universally, asymptomatic or not, staff member or resident. Everyone is offered testing. And that's on the strength of some recent data that have been published, some by the US CDC, some in a very prestigious medical journal, the New England Journal of Medicine, that have showed that in long-term care facilities, a high number of individuals there can test positive without symptoms. That is actually entirely consistent with what we've seen in Maine. And it's important to know at baseline what their status is so appropriate measures can be taken into account, such as the cohorting that we talked about a moment ago. So again, right now, our policy is that for any long-term care facility where an outbreak is detected, we immediately offer testing across the facility to each and every staff member and resident there. I'd like to turn next to Brian Sullivan at WABI.
This question is for either Dr. Shaw or the Commissioner. Thank you for taking the call. In terms of the congregate care facilities, I was wondering how much of the work you do is proactive versus reactive, and with these 3 outbreaks that occurred very recently, did that lead you to believe that you needed to go back over protocols and host things like the webinar and send back out the materials and ask the facilities where they felt there were shortcomings?
Sure. So Brian's question is about what we've done in advance of an outbreak and then what we do after an outbreak is detected. And Brian, what we can say about outbreaks in facilities is that we saw the signs early on. We saw what was happening in Seattle, King County with the facility there. In fact, even before that, based on the experience of the team of epidemiologists at Maine CDC, We knew early on with any respiratory virus, congregate settings, especially where medically vulnerable folks live, like long-term care facilities, we knew that that needed to be a primary area of focus for us. As Commissioner Lambrou detailed, we started our outreach to long-term care facilities over a month ago by hosting webinars, guidance documents, providing them written materials, a toolkit, a checklist, and all of that was done in advance of what we knew could happen in Maine and is happening now. I say that because there's an old saying in public health, which is that what we can predict, we can try to prevent. And so we knew that there was a high likelihood of these types of occurrences happening. Now, what we're doing now is intensifying our efforts, and I'll turn that over to Commissioner Lambrou.
Sure. And that intensity is taking much of the same material that we provided and providing it again to making sure it's in the hands of the right people. Sometimes material comes in and doesn't get, for example, to the nursing director or the clinical director, and we want to make sure the people who are going to be doing infection control have it, the administrators who are going to be looking at how you organize facilities get it. We want to double down to make sure, even if they're hearing us for the second or third or fourth time, they hear us again this week, because we feel quite strongly that we want to make sure we're not missing any opportunities for this work. I will add that I think we're willing to offer technical assistance. We have some experts that are just willing to help, who really know how to do this to prevent, in the best possible way, any sort of outbreaks in facilities. If a facility needs that help, if they're small or in a rural area, we're there for them.
Yep.
We have contacts that are going to be in this email to get to every clinician, every medical provider, and nurse in the state of Maine today. Those contact informations are going to be in those notes. Do not be afraid to ask for help. And I will end by adding, the Maine Healthcare Association, which represents many of our nursing facilities and group homes, has been a good partner. We've been working with them, as well as our home care agencies. I don't want to forget the fact that many of our residents who are older and in need of long-term care reside in their homes. Mm-hmm. And to that end, we did actually announce with the governor on March 30th that we would increase their pay. We know that some are tempted to maybe go and work at the local grocery store that is increasing pay in this time of crisis, instead of doing the hard work of caring for people at home. We announced in March that we will be accelerating a pay increase authorized by the legislature to April 1, which will be about a 24 to 30% pay increase for about 20,000 direct care, personal care workers in the state of Maine.
Great. Turn next to Allison Ross from WMTW. Go ahead, Allison.
Yes, thank you so much for taking my question. Now, we have heard, and this is kind of something that we've seen articles on too, if someone is worried about their loved one, specifically in one of the 3 long-term care facilities that you've mentioned, or in any facility where there aren't any cases yet, should they consider pulling their loved one out of one of those facilities?
It's a good question. Allison's question is how should individuals, for those of you who are watching right now, if you have a loved one, a spouse, a sibling, a parent who is in a long-term care facility, what should you do right now? And of course, the ultimate decision of what you would do with your loved one is one that's between you, that loved one, and your healthcare provider. There are some important considerations to keep in mind. One of the ones that is that these facilities are staffed by medical professionals. And so if your loved one were to get ill for any reason, there's always the benefit of being in a facility because there's nursing care available, someone who can see and is trained to see the early warning signs. Another consideration is the fact that when individuals, especially those who may be older, when they're moved into a new environment, that can be a challenge to navigate. If you've ever spent the night in a brand new hotel and gotten up in the middle of the night to use the restroom and stubbed your toe, you know that what that's like, because you thought you were at your home and it turned out you were someone else. But when you're older and medically vulnerable, that stubbed toe can be a fractured hip. So there are a lot of considerations that have to be taken into account. The ultimate decision is one that should be made jointly, shared between the family, the resident, and the healthcare provider, but we recognize how challenging that is. We'll turn next to Kevin Miller.
Hey, thanks, Dr. Shaw. Building on Steve Missler's questions about testing it at long-term care facilities, has there, as I understand right now, that the testing of everybody, all the residents and the staff, only happens when there is a positive case? Has there been any thought about doing, proactive testing, before anybody has symptoms? Yep. And is that even feasible? And then a secondary question about home care providers. Do we know if any cases out there stem from home care providers or any home care providers who have tested positive?
Right, so Kevin's first question is about testing in facilities for COVID-19 that have not yet experienced any cases. Kevin, it's something we've talked about. And there, as you can imagine, it would be a logistical challenge. But that's not a reason not to do something. The reason that we express concern around it is something we've talked about in these meetings, which is what to do with negative results. Even within facilities that are experiencing an outbreak, and this came up on both of my calls with the leadership of Augusta Health, of Augusta Rehab, as well as the Maine Veterans Home. We've already completed one round of testing in both facilities. We detected a fair number of positives, but we also detected a fair number of negatives. When should we retest, given that there were a fair number of negatives? What would be the appropriate interval during which to retest? That same question gets amplified and magnified several-fold when you go in to test a facility where there's no outbreak. We might detect some positives. It's impossible to speculate. But what should we do and how should we think about the negative results? Should we go back and test the next day, the next week, the next month? So it's not as if we're against it. We're open to the idea, and our epidemiology team and I have openly discussed it. But we've got to have a plan in place for what to do with results and what actions we would take, especially around retesting, once that were the case.
Yeah, and I would just add some numbers to put this into context. Right now, we have about 6,800 people in our nursing facilities in the state of Maine. And statewide, across all different types of settings, we have nearly 100,000 healthcare workers.
Mm-hmm. So logistical challenges abound. So, Kevin, you had a second question as well. Just wanted to make sure I answered that.
Yeah, my second question was about home care.
Home
workers.
care. Yep.
Whether those do you know of any home care workers who have tested positive, or is there any evidence that someone has contracted the disease from a home care worker, anything like that?
Kevin, about with respect to home care workers, we mentioned this, touched on it a bit last week, and I again want to give home care workers of all stripes, whether they be occupational therapists or hospice nurses, they're on the front lines of the front lines. They're going into people's homes, and I just want to recognize the work that they do and the places in which they do it. We're not aware of any home care workers who have tested positive, but we will check and see of the healthcare workers. We'll check to see if any of them is a home care worker. I am aware by report, having had a conversation last week with the owner, operator, and CEO of a large home health agency, that they are taking care of a number of COVID positive patients. But your question is around the home health care workers themselves. We're not aware of any who have tested positive. We are making sure that they are equipped with PPE, and just last week had some conversations around clarifying what their role is to make sure that they're able to get PPE, again, recognizing that they are going onto the front lines of the front lines into people's homes. Thanks for that question, Kevin. We'll turn next to Dan Newman from the Maine Beacon.
Hello, Dr. Shaw and Commissioner Lambrou. I was just wondering if you guys could give us an update on what's going on with homeless shelters. Are they expanding capacity? Are there any more sustainable solutions coming forward, for instance, like placing people in hotel rooms?
Sure. And the question for those who didn't hear it is, what is the status of addressing our homeless populations in the state of Maine? So starting with Portland, we have been working with the city, the county, our private sector partners in the area, as well as our University of Maine partners, to develop 3 different sites. One site is for people who are COVID positive or are being tested. That is a place where they can be appropriately distanced and monitored for symptoms. A second site is for individuals who have been exposed to somebody but who are homeless. It had previously been the Portland Expo. We are working with the Maine State Housing Authority to see if we can secure hotels for that purpose rather than using the Expo. We're cautiously optimistic that we have an answer there soon. And then the third is a place for people who are homeless so they can be in that physical distancing 6 feet apart spread, which is not the current situation at, for example, the Oxford Street Shelter, which is very tight quarters. So that has been the Sullivan Gym in the Portland area. That has been stood up and operational, so we feel as though there's a system that is working and will be working better over the coming days and weeks in the Portland area. We similarly are doing work with the city of Bangor and Lewiston. Each one of these places will be unique in their own constellation. Presque Isle is also working with the gracious offers from the University of Maine system to use some of their gyms and other facilities to house people who otherwise would be homeless. And we feel as though place by place we're beginning to come to solutions with, hopefully again, our colleagues at Maine State Housing Authority coming up with a relationship with hotels that can really broaden this up so that could be accessible statewide.
Great. And the last question today goes to Brad Rogers. Go ahead, Brad.
Okay, hi, thanks very much for taking the call. Just a couple quick questions. One is you didn't update the number of people who may have passed away at the Maine Veterans Home. Another quick one is, has there been any consideration to residents at those long-term care facilities who test negative to possibly moving them to another facility altogether? And then lastly, according to the Augusta Center's website, PPE is only being worn when interacting with residents who are sick. Now, that may be an old thing they posted on the website, but was that the case? Are they now wearing PPE all the time?
Okay. So, Brad, with respect to the Maine veterans, we are aware of one unfortunate fatality that has occurred, a resident who passed away there on April 3rd. That is the only fatality that we are aware of there. And could you just run your second question?
Sure. For those residents who tested negative at Long Pines and also the Tall Pines and the Augusta Center, is it even feasible to possibly move them to another facility?
So, Brad, that's a question that's ultimately up to the family, the facility, and the healthcare worker. But one important thing to note, and for those of you who are watching and have family members in such facilities, if you have a loved one who happens to be a resident of a facility where an outbreak is occurring, it's important to note that the virus can take up to 2 weeks after someone has been exposed for signs and symptoms to show up. And so even if you happen to move somebody, say today, it's possible that they've already been exposed. And by staying in a shelter, they have that round-the-clock nursing care that can watch for signs and symptoms. It's a very difficult and challenging question, Brad. There is no one single answer to it. We really recommend that families, healthcare providers, and facilities make these decisions in a shared manner, keeping in mind the fact that it can take up to 14 days for symptoms to occur, and then also recognizing that individuals in brand new environments, especially if they're older, it may take more time to adapt, and they can suffer falls and other things that can also put them in jeopardy. Again, it is a difficult decision, and it's one that we recommend be made in a shared fashion. So before I wrap up today, I just wanted to again take a moment to acknowledge all of the individual men and women who are working in long-term care homes across the state. These aren't facilities, they're not institutions, they are communities, neighborhoods, and homes. And so if you have a spouse, a sibling, a parent, or a loved one who's a member of one of these communities, know that there are men and women across Maine who are continuing to show up each and every day to care for and tend to them. Please send them a note of thanks. Please send them a note of gratitude. because they are helping to keep every one of our extended families safe. Thank you so much, everyone, and we'll talk tomorrow.